Friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, so today we will have a discussion on approach to child with congenital cardiac problems. Congenital cardiac disorders in children. Now, congenital heart disorders are defined as structural, functional, and positional defects of the heart in isolation or in combination, which is present since birth, but may manifest at any time after the birth or sometime may not manifest at all. This is the definition of congenital cardiac disorders. So basically, they are present since birth. They are of structural, functional, and positional variety. They manifest sometimes they manifest with the severe symptoms, presentations, and some of the congenital malformations may not manifest at all, and it may be only an accidental finding. Among all the congenital problems in the children, the congenital heart problems constitutes about 30%. So major 30% is a major portion, and among all the congenital problems in children, including all the systems, only congenital heart problems constitute for 30%, which is very, very significant. Now, general reported incidences are about 8 to 10% in 1000 live newborn population. So even the reported incidences are also significantly high. Now, there are basically 8 major lesions which constitutes about 85% of the total cases. Now, if you take 100% of the total congenital cardiac problem cases, out of that, about 85% is constituted by major 8 lesions. The major 8 lesions are ventricular septal defect, patent ductus arteriosus, atrial septal defect, pulmonary valve stenosis, aortic valve stenosis, coarctation of the aorta, tetralogy of the fallet, and transposition of the great vessels. So these are the 8 very common congenital cardiac malformations or disorders in children, and it constitutes about 85%. And rest of the 15% of the cases are there in the heart related to congenital cardiac problems. So they may be some of the complex congenital malformations. Now, the frequency of congenital cardiac problems is almost all equal in male and female, but still some of the lesions are more common in male and some of the lesions are more common in female. For example, some lesions like coarctation of the aorta and aortic stenosis, etc., are more common in the males. Whereas some of the cardiac lesions for like patent ductus arteriosus and atrial septal defect, this is more common in females. Now, because there are some of the syndromes are there, for example Turner syndrome, etc., so they do have some of the congenital cardiac problems also. So as some of the syndromes are more common in male and some of the syndromes are more common in female, like Turner syndrome, Klinefelter syndrome, etc., the associated congenital cardiac anomalies along with that syndrome is also equally common in the same gender. Now, 13% of the child with the heart defects will have another associated heart defect. Now, if the child has got one heart defect, it will definitely have another associated heart defects, and this is true in about 13% of the cases. And about 10 to 15% of the cases will have non-cardiac defects associated. Suppose that the child has got one cardiac defect and that child may have any other systems congenital problems like GIT related or the respiratory system related, CNS related, and this is true in case of 10 to 15% of the cases. Now, when we look into the etiology of congenital cardiac problems, basically talking, there is no any specific causes yet identified, but we have got multiple theories and multiple proportions for that. Okay, multiple understanding will be there, and multiple theories we have been put forth for the same. So first is inheritance. Yes, because we have got so many inherited disorders like chromosomal disorders, single gene disorders, etc., autosomal dominant, autosomal recessive, X-linked, and many of the syndromes, as I told earlier, are associated with congenital abnormalities. For example, a autosomal dominant trait is always known to have some of the structural defects, and this structural defect may be related to heart, nervous system, or GIT, etc. For example, Marfan syndrome. Marfan syndrome is one of the best example, which is very common autosomal dominant trait, and usually it is associated with the heart defects. Similarly, Down syndrome, usually it is associated with the heart defects. In case of the Turner syndrome, etc. So inheritance is one of the major factor as a part of the syndrome. So there is also involvement of the heart. Another is chromosomal abnormalities like trisomies and monosomies, as I told earlier. So there is also multiple defects will be there, multiple systems will be affected, and as a result, one of the system which may be affected is cardiac in the form of congenital cardiac problems. Another important theory is environmental. Environmental means it refers to intrauterine environment and extrauterine environment. Now, intrauterine infections are considered to be one of the major causes. Okay, so torch infections, especially rubella, may be the case, or toxoplasmosis, or even the varicella. So these are some of the very common intrauterine infections which cause significant amount of cardiac problems. Okay, so torch infections, toxoplasmosis, cytomegalovirus, and these may be also associated with the cardiac defect. So this is a major thing. So environmental, what we say in Ayurveda, satmyaja bhava. So that is environment, intra-uterine environment, extra-uterine environment, and Ayurveda also talk about intragonadal environment. That means before copulation, what actually happens, intragonadal environment, and the sperm, and as well as how the sperm and how the ovum has been brought out. Okay, so what is that, which environment it has been grown. For one of the best example is Down syndrome. If you look into Down syndrome, incidence of Down syndrome increases as the maternal age advances. Okay, now here one of the environmental factor for this particular Down syndrome is the ovum which is present in the maternal body is exposed to the external environment for a very long time. Maybe at the 40th year the mother is deciding to go for a baby. Till 40 years, that particular oocytes which are present in the ovary, so they are get exposed to so many stress factors, so many environmental factors, toxins, etc. And that may result in trisomies when that particular ovum gets shedded off and undergo fertilization, and there's the formation of the fetus. So intrauterine, this is what contemporary science says, and extrauterine, but Ayurveda also talks about intragonadal, before the puberty and before the reproduction age, the stages of the state of the gonads. So that is also plays a very important role. So another is maternal drug consumption. Now maternal drug consumption is one of the most common cause. A mother is consuming some of the drugs, anti-epileptic drugs, maybe anti-diabetic drugs, anti-thyroid drugs, and similarly some of the psychotropic drugs. So this is one of the major cause. And non-steroidal anti-inflammatory drugs like indomethacin, etc. So they're also aspirin, indomethacin, etc. They're also one of the major cause because they block the prostaglandins, and as a result development of the fetal anomalies related to the heart is quite common because of the premature closure of the two major ducts of the heart. That means two major vessels of the heart. Anyway, so some of the pregnancy-induced systemic disorders may be the cause. Maternal disorders like diabetes mellitus, SLE are also the leading cause for this. Another theory is multifactorial causation. So abnormality of the gene itself is not significant cause. Now, a multifactorial causation means now it's a combination of many things. Okay, so not only the abnormality of the gene which is caused, that particular little abnormality, a small amount of the or minute abnormality of the gene which is actually not in a position to cause any disease, if it is get aggravated by some of the other factors or triggering factors, then that gene may undergo a expression of a disease. So therefore abnormality of the gene itself is not a sufficient cause. Association with other environmental factors, exposure to radiation, exposure to drug therapies, and exposure to stress, and these are all when come in combination, so actual disease may manifest and it may lead to congenital cardiac problems. So these are different theories which is proposed in relation to congenital cardiac problems. So when we talk about the symptoms which is very common in congenital cardiac problems, all the defects are present, the physiological disturbances lost. Now, in case of congenital cardiac problems, there may be many defects, but actually talking, the physiological disturbance which is going on is actually less, because body will going to compensate for that. Body will going to compensate for that. So anyway, physiology will be maintained. Anyway, there may be some compensation, there may be some compromisation, uh, a physiological adjustment, readjustment of the hemodynamic system, but the presentation of the symptoms will be less actually. It is not true in case of very severe lesions, in minimum ordinary lesions. And there may or may not be cyanosis in infancy or throughout the life. Sometimes in some of the cardiac lesions, although there is a cardiac lesion, there may not be any cyanosis throughout the life, in the infancy and also throughout the life, because there will be adjustment. And if the lesion is present in the right side of the heart, suppose the lesion present in the right side of the heart, usually we will have cyanosis as a major symptom. And if the lesion is present in the left side of the heart, the cyanosis may not appear, and if it appears also, it appears later part. Next, some of the other symptoms, if you are talking, then maybe the heart failure. Sometime it may be or it may not be. Heart murmurs, we will discuss about heart murmurs later. Then circulatory shock, these are some of the symptoms sometimes. Stridor, because of the obstruction and all. And the cyanotic spells, and recurrent respiratory tract infections and growth failure. So now these are some of the major things. Now into the physical examination, clubbing will be maybe there, JBP may be there, and heaving of the apex may be there, or overactive precordial region may be there. So these are some of the physical findings on examination. Now symptom wise, the analysis, why it is coming and how it is coming, so that we will look into this, that we will discuss in the next class. Thank you very much for being with me. Don't forget to subscribe my channel, and also please